All right, so we're diving into atrial fibrillation today, or AF for short. We got a really interesting video from the Practical GP YouTube channel.
Oh, yeah, I love that channel.
Using AI patient cases to demonstrate like the latest NICE guidelines, which is a really cool way to see these guidelines in action instead of just reading through like, a dry medical text.
Oh, absolutely. Yeah, using those AI cases really brings the guidelines to life and gives us a practical perspective on how GPs actually approach AF management in different, real world situations. It's really helpful for, for everyone, really, both healthcare professionals and patients.
Right. Yeah, exactly. So before we jump into those cases, let's quickly go over what AF is and why it's so important, especially in primary care.
Sure. So AF, it's basically an irregular heartbeat. It's where the heart's upper chambers, the atria, they kind of quiver instead of beating, effectively. And it's really common, actually, especially as people get older. And if it's not managed properly, it can lead to some pretty serious complications. So, that's why it's such a big deal in primary care.
Yeah, that makes sense. And, we often hear about NICE guidelines, especially in the UK. Can you tell us a bit more about what NICE is and what role they play?
Oh, of course. So NICE, it stands for the National Institute for Health and Care Excellence, that basically set the standards for, high quality care here in the UK. And their guidelines are really important because they're evidence-based, which means they're like rooted in the latest research and best practices. So they really give doctors a framework to ensure that patients are getting consistent and effective care, across the NHS.
Right. So they're like a guiding force for healthcare in the UK.
Yeah, exactly.
So let's imagine you're a GP and you have a patient coming in with potential AF.
Yeah.
What are some of the first things you do, to figure out what's going on?
Well, the first thing a GP would usually do is just a simple pulse check. They'll feel for any irregularities in the pulse, and that can be a telltale sign of AF. And if they detect any irregularities, then they'll usually do an ECG, which is an electrocardiogram.
An ECG, right? So that gives them a more detailed look at what's happening with the heart's rhythm.
Exactly. It basically records the heart's electrical activity, and that can help confirm, whether it's AF or not.
Yeah, but sometimes AF isn't constant, right? I mean, what if it's paroxysmal, meaning it comes and goes? Yeah. How do GPs catch those like tricky episodes?
Right. Yeah, that can be a bit tricky. In those cases, doctors might use continuous monitoring. So there are these portable devices like ambulatory ECG monitors or event recorders that patients can wear, and they basically record the heart's activity for much longer periods, sometimes even for weeks.
Oh wow! So they're constantly monitoring for those irregular rhythms.
Yeah, exactly, and that allows them to capture those those intermittent episodes that they might miss during a routine checkup. And early detection is it's really important because it opens up more treatment options and it can potentially prevent long-term complications.
Yeah, that makes a lot of sense. So let's say AF has been diagnosed. What's next? I imagine there's no like one-size-fits-all approach to managing this condition.
Oh, definitely not. Managing AF effectively it's all about a personalized approach, really. The diagnosis, management, and then an annual review. And each step, is tailored to the individual patient, taking into account their circumstances, their, risk factors and everything else. And speaking of risk factors, I'm reminded of those two scores, CHA₂DS₂-VASc and the ORBIT. They might sound like, something out of a sci-fi movie, but they're actually really important tools for GPs.
Yeah, I remember those. They sound a bit intimidating, but they're basically used to assess a patient's risk, right?
Yeah. Exactly. So the CHA₂DS₂-VASc score, that one helps doctors assess a patient's risk of stroke. And, that's a significant concern with AF because basically with AF, the heart's not beating as efficiently. So blood clots can form and those clots can travel to the brain and cause a stroke. So this score takes into account things like age, history of heart disease, other medical conditions, to determine the likelihood of those clots forming.
So it's like a way of gauging how likely a stroke is.
Exactly.
And what about the ORBIT score? What does that one tell us?
So the ORBIT score, that one looks at the other side of the coin. It looks at the risk of bleeding, which is important because some AF treatments, while they're, crucial for preventing stroke, they can actually increase the risk of bleeding. So this score helps doctors understand, how likely a patient is to experience bleeding complications, especially if they're, on blood thinners.
So it's like a balancing act, right?
Sure.
So let's say someone comes in with what's called new onset AF, meaning it's been diagnosed within the last 48 hours or so.
Yeah.
Is that considered an urgent situation?
Well, yeah, new onset AF, it can often require, swift action, the importance of seeking urgent specialist advice in these cases. So this could mean, referring the patient to a cardiologist, or even sending them to the emergency department, depending on how severe their symptoms are and if there are any, potential complications.
So there's a real sense of urgency with new onset AF.
Yeah, absolutely. Early intervention is really key in those cases because there's a window of opportunity potentially to restore normal heart rhythm, using procedures like electrical cardioversion, and prompt treatment with anticoagulants can also help minimize the risk of complications like stroke.
Right. So it's about acting quickly to try and get that heart rhythm back to normal.
Exactly. In these situations, timely action can really make a difference in the patient's long-term outcome.
Okay, so we've talked about, diagnosis and initial management, but what about ongoing management of AF? What are GPs looking for during follow-up appointments?
Right. Well, the importance of identifying and managing the underlying causes of AF, because AF, it's not always a standalone condition. It can be triggered by a variety of things, things like high blood pressure, heart valve problems, thyroid disorders, even infections. So by identifying and addressing those underlying causes, GPs can often make a significant difference in managing AF effectively.
So it's like you're not just treating the AF, you're trying to find the root cause and address that as well.
Exactly. And, to get a complete picture, GPs use a variety of tools. They use ECGs, chest x-rays, blood tests, and sometimes even echocardiograms.
Oh, wow. So it's a very comprehensive approach.
Yeah. It's all about, pinpointing that root cause and determining the most effective treatment plan for each individual patient.
So we've talked about the underlying causes. Now, what about the treatment options for managing the AF itself? What are some of the approaches that are used?
Right. So there are two main approaches. There's rate control and then there's rhythm control. So rate control, that focuses on managing the heart rate, so making sure it doesn't become too fast, even if the rhythm is still irregular. And that can be achieved with the medications like beta blockers or calcium channel blockers.
So it's about controlling how fast the heart is beating, even if the rhythm is not perfect.
Right, exactly. And then there's rhythm control, and that one aims to, actually restore the heart's normal rhythm. And that might be done through medications or sometimes through procedures like electrocardioversion.
Okay, so you have two different approaches depending on, I guess, the individual patient and the severity of their AF.
Exactly. It's a very nuanced decision-making process.
So we've talked about rate control and rhythm control, but we haven't really touched on stroke prevention, which we know is a major concern with AF. So what's a typical approach for addressing that risk?
Yeah, so for stroke prevention, anticoagulation therapy is really the cornerstone. The goal is to prevent those blood clots from forming in the heart and then, potentially traveling to the brain and causing a stroke. And these days, DOACs, which stands for direct-acting oral anticoagulants, they're often the preferred choice. They're generally considered to be, more convenient. They have fewer interactions with other medications and food compared to, some of the older anticoagulants like warfarin. So
DOACs are kind of like the newer generation of anticoagulants.
Yeah.
And why are they generally preferred over warfarin?
Well, they have a few, key advantages. For one, they don't require that frequent blood monitoring to adjust the dosage, which is obviously, more convenient for patients. They also have, like I said, fewer interactions with other medications and food, which just simplifies management. And studies have shown that DOACs are, at least as effective as warfarin in preventing stroke, and in some cases even better.
So it's a win-win, basically, more convenient and potentially even more effective. But you mentioned that they're not suitable for everyone, right? So are there situations where warfarin might still be the better option?
Yeah, that's right. So DOACs, they're not suitable for people with artificial heart valves or certain types of valvular heart disease. So in those cases, warfarin is still the recommended anticoagulant. And doctors also need to carefully consider the patient's kidney function, because some DOACs are primarily excreted through the kidneys. So if a patient has, kidney problems, then a different DOAC or even warfarin might be a safer choice.
Okay, so even though DOACs are, generally preferred, there are still specific situations where warfarin might be the more appropriate option.
Exactly.
Okay, so we've covered a lot, diagnosis, risk assessment, rate control, rhythm control, and anticoagulation. But what about the patient's role in all of this? I mean, how can patients be more, I guess, actively involved in their own AF management?
Oh, yeah. Patient education is absolutely crucial for successful AF management. GPs should really be explaining to their patients, what AF is, how it can impact their health, and the potential risks, including a stroke. And they should also discuss, lifestyle modifications, things that patients can do to help manage their AF.
Like what kind of lifestyle modifications?
So things like maintaining a healthy weight, exercising regularly, limiting alcohol intake, managing stress. All of these things can really have a positive impact on their heart health and potentially reduce the frequency and severity of their AF episodes.
So it's about taking a holistic approach, right? It's not just about medication, it's about making lifestyle changes as well.
Exactly. And GPs should also address some, practical concerns that patients might have, like driving and flying, which are, common questions. Generally, flying is, not an issue if the AF is well managed, but driving restrictions might apply depending on, the severity of the AF and the specific regulations in their country.
Right. So it's important to address those real life concerns so that patients, feel informed and confident in managing their condition in all aspects of their life.
Exactly.
Okay. So we've laid a really good foundation here for understanding AF and its management. But now for the really interesting part, those AI generated patient cases. Are you ready to dive into those and see these guidelines in action?
Absolutely. I'm really excited to see how these simulated patients, bring the guidelines to life and give us a more practical insight into the decision-making process.
Great. So our first case is Emily Thompson. She's a 62-year-old woman with hypertension, high cholesterol, and type 2 diabetes. She's already taking medications for those conditions. And she comes in complaining of, occasional palpitations and breathlessness. And she's also been feeling a bit dizzy now and then. What's the first thing that comes to mind when you hear about her, her symptoms and her medical history?
Well, given her symptoms, it's natural to suspect AF. The palpitations, the breathlessness, the dizziness, those could all be, signs of an irregular heartbeat.
So what would be the initial step that the GP would take to investigate further?
Well, they would most likely begin with a simple pulse check, just feeling for any irregularities in Emily's pulse. That would give them an initial clue.
Okay, so the pulse check is a quick and easy way to kind of get a first impression.
Exactly. And if the pulse check, reveals any obvious irregularities, then it would, strengthen the suspicion of AF and they would move on to further investigations.
Right. But we know that sometimes AF can be, tricky to catch, especially if it's paroxysmal, if it comes and goes.
Right. Exactly. So if the pulse check doesn't, reveal any obvious irregularities, but the GP still suspects AF based on, Emily's other symptoms and her medical history, then they would probably proceed with an ECG to get a more detailed look at her heart's electrical activity.
Okay, so the ECG would be the next step in the process. And if that initial ECG doesn't show any signs of AF, but the suspicion is still high, then the GP might consider, those continuous monitoring devices we talked about, like the ambulatory ECG monitor or the event recorder, right?
Exactly, yeah. Those devices can be, incredibly valuable in capturing those intermittent AF episodes that you might miss during a routine checkup.
Well, we've just started exploring Emily's case, and we're already seeing, the importance of a thorough investigation and that personalized assessment.
Yeah, it's a great reminder that AF management is not always straightforward.
Absolutely. Well, we have one more part of our deep dive to go, so stay tuned as we explore more AI patient cases and really delve into the nuances of AF management in the final part of our show.
Stay tuned.
Stay tuned.